Hi, Dr. Giles here. Not long ago, I posted a video about viral versus bacterial infections. In this clip today, I've pulled out those examples so that it's easier to follow along. If you'd like more detail, please head over to my other video. I've linked it in the description. Now, for example 2. Your child wakes up with a sore throat, a little bit of a cough and runny nose. They're still drinking well and they're still running around playing, but they're still occasionally complaining that their throat's bothering them. So, common things being common, this is probably a virus, especially with it just starting this morning. At this point, you'd continue with supportive care and continue to monitor them. So, let's change it up again. Your child wakes up in the morning with the sore throat. They have a fever, but they don't have the other symptoms. They don't have a runny nose or congestion. So, in this instance, you might think, well, is it a virus? It just barely started. But there's a couple other clues telling us that this may not be a virus. First, localized pain, just to the throat. And there's no other symptoms. There's no cough. There's no runny nose. And if you're to look in their throat, you might even notice large tonsils and some white stuff on those tonsils. Now, if you were to take them to the doctor at this point, the doctor would do the physical exam, they'd see the tonsils, and then they'd probably do a swab to check for strep throat. In this instance, the swab came back positive and they have strep throat, which is a bacteria. And so we can treat it with antibiotics. I hope this helped a little bit to clear up virus and bacterial infections. That's it for now. Stay healthy, and I'll see you next time.